Hi, I'm Jason, student PTA, here with a patient with low back pain. We're going to go over some exercises and some education, traction, and hot pack with you today. I have his permission to videotape him. This is Mason, my stepson. During your last visit, you saw the physical therapist for your low back pain, stating that you heard it pulling a heavy suitcase out of your trunk. That's a big no-no. Don't do that. Stated that you had a low back pain 6 out of 10 with symptoms radiating down your right leg with pain 3 out of 10. Pain with prolonged sitting, which I know you stated you do computer work, so you sit at your computer all day long. And has anything changed? Is it still roughly the same? It's only been just a couple months.
Yeah, it's about the same.
About the same. Okay. Well, first off, we're going to go over some education stuff to try to help you with your daily routine. Try to ease up some of the pain if we can. First thing is try to take walks periodically through the day just to keep everything mobile, limber, especially since you sit a lot. You just don't want things to constantly get tight on you. Don't sit for long periods, which with your job you tend to. But try to sit 15, 20 minutes max and then get up and just move around a little bit, go get a drink of water, something, just to get moving a little bit. Limit your twisting at the hips, because naturally your low back controls your whole body, and all your upper body weight rest on your low back, so any extra twisting you do is going to hurt something further, increase your symptoms. If something falls on the floor and squats hurt you to pick it up, with normal activity, that's how you want to do it, is a squat. But if that hurts, just try doing like a golfer's bend, where they bend down to get the golf ball or the tee or something like that. If you have trouble with that, just buy you a grabber that has the little squeezy thing on the end of it to pick whatever up off the floor. Just little things to help you. With you at work, talk to your boss or something, see about getting a desk that raises. That way you can work and stand at the same time. That way you're not hindering on any of your work productivity. Another thing is try sitting on a pillow, because a lot of times the pain will radiate up through your sacrum, right up into your low back, and cause symptoms that way. And then something else would be to put a pillow behind your low back. That way it kind of gives you more of the extension instead of sitting upright, causing any radiating pain that way. A few things we're going to do with you is we're going to do some McKenzie extension exercises, some lumbar stabilization exercises, traction, and hot pack. Have you ever had any of this done? Any traction or anything like that? Okay, which I kind of figured. This is your first treatment. What we're going to do is we're going to go over some precautions and contraindications of the hot pack and the traction, even though we're not going to do them until the end of the treatment. I just want to, since we're sitting here now, we'll go ahead and get them out of the way. Okay, so for the traction, do you have any claustrophobia? Any vascular symptoms?
No.
Impaired cognition? We're not doing cervical traction, so we don't have to worry about your TMJ. You don't have a medial disc protrusion, but you do have a posterior lateral protrusion, which is why we're doing the traction. Hiatal hernia? No? I hope you're not pregnant, are you? Any diseases such as osteoporosis, tumor, infection or anything in the spine? Rheumatoid arthritis?
No.
Any disc extrusion?
No.
Which I'm assuming you don't. And since you've never had it done before, you don't know if you've had any recent pain because of the traction. Any acute sprains, strains, or inflammation? Any fractures of your spine?
No.
Spinal joint instability or hypermobility? No. No?
No.
It says you're healthy, so I'm assuming you don't have hypertension or anything like that, high blood pressure. Decreased myotomal strength, which I'm assuming since you're a younger fella you don't. Spondylolisthesis, if I don't have that.
No.
If you did have that, we definitely would not be doing traction, because that would be very painful. You haven't had any post-op surgery or anything for your spine. Spinal cord compression, they haven't said anything about that. Increased peripheralization of pain, numbness, or tingling. Or decreased reflex response. Do you have any of that? Okay, well that's all good. We'll go over the hot pack. See if you anything there. Any cardiac insufficiency?
No.
This is all with precautions. Edema, which is just swelling. You don't have any of that, do you? Impaired circulation.
No.
You haven't had any medications or anything applied to your back?
No.
Any open wounds?
No.
Any impairment with heat? Like cause you burns or anything like that? You don't have any metal implants or anything?
No.
Again, about pregnancy, which I'm hoping you're not. Or demyelinated nerves. I don't have that, which is good. Okay, contraindications for your hot pack. No acute or subacute trauma recently or inflammatory conditions. We already went over decreased circulation and decreased sensation, which you don't have. Deep vein thrombocytes, or whatever. Any issues with deep vein thrombosis. We already did the impaired cognitive function. You said you had no tumors, no hemorrhage or edema. And you're right in between. You're not very young, you're not very old, so I think we can skip past those. Alright, well, so we're good on all that, so we won't have any issues with doing a traction. We just have to monitor, watch pain or anything like that, make sure it doesn't increase. And keep an eye on the hot pack, make sure it's not too hot, don't get blisters or anything like that from it. First thing we're going to do, I already did the education of everything, is we're going to start out with the McKenzie exercises, which are all extension. So I know you said it tends to hurt kind of going into the flexion and stuff like that, so we're going to do the opposite and see if we can eliminate some of that pain or pressure you're experiencing. So we'll go ahead and stand up. We're only going to do one in standing, and then everything else is going to be on the table. First one is while you're staying there, just kind of put your hands on your hips and extend back as much as you can and hold for 2 seconds and then relax. We're going to do that 10 times. Pain or anything increasing with that, or are you doing okay?
No, just like he's stretching out more.
which it helps stretch out your abs as well,
Mm-hmm.
keep everything loose. Did you get all those? Okay, go ahead and hop up here on the table, head on this end on your stomach. Next one we're going to do is it's called a prone prop. Basically what you're doing right there is up on your elbows. You're going to hold for 5 seconds, then lower down, then back up. We're going to do that 10 times. Any pain or anything with that?
No.
I should say any increased pain. Nothing down the leg or anything.
Not really. How many?
10. Next one is basically the same thing. You're just going to stand all the way up onto your hands with your elbows straight. Hold for about 2 seconds, relax. We're going to do those 10 times. How's that one feel? Any increase, pain or anything?
No, just stretching more.
Stretch, yeah. It's definitely a good one for stretching the abs. And we'll see how all these do on your next treatment. Because we can always incorporate this at home. That way you can do 2 of them.
Mm-hmm.
Okay, the next one. Go ahead and lay your head, just kind of lay completely flat. Put your head down on that. What we're going to do is we're going to tighten your butt muscles. Just kind of squeeze your butt together. You don't need to hold it, just squeeze it and relax. We're going to do 10 times. Alright, the next one we're going to do is you're going to put both arms out to the front of you. Thumbs up in the air. Kind of relax down, keep your head against the... You're going to lift one arm at a time up just a couple inches. Hold it for a couple seconds and lower. And then we'll do the opposite arm. Just go back and forth, each arm 10 times. Keeping your abs tight. Any pain or anything with that one? Any increased pain?
Mm-hmm.
Any difficulty?
No.
Okay. Alright, next one is you can relax your arms however you need to be comfortable, but you're going to continue laying on the towel there. This one, you're going to do kind of what you did before, tightening up the butt. But when you do, you're going to raise one leg at a time, just up about 20 degrees, which isn't very far. I mean, you can only go up 30 anyway. So just lift it up just a little. Hold it just for a second or two. Lower it back down. Do the opposite leg. We're going to do this 10 times each leg. All this will help strengthen that lower back as well. Try to help any muscle spasms, help loosen any of that up. Okay, next thing we're going to do is that's all the exercises we're going to try for today since this is your first treatment. Next we're going to do the traction with the hot pack. It said in your previous treatment that you can only do hip flexion of your right leg to about 30 degrees. So in order to do it in supine, which would be you laying on your back, you'd have to have your knees bent to a 45 to a 60 degree angle, your knees and hips. I'm afraid that's going to hurt you and cause more pain, so we're going to try it in prone, which is perfectly acceptable to do, and see if we can just eliminate any pain that way. So we're going to take this pillow, we're going to put it up underneath your abs. That way give you more of that natural curve. You can continue to lay your head on there. Does that feel okay? Comfortable?
Yeah.
Okay. And what we'll do is we'll hook everything up and it'll attach here. That way you don't pull everything down, and you'll have another harness up here to keep you locked in place. You said you're about 140 pounds.
Mm-hmm.
Normally we do 50%, which would be 70 pounds, but since you have the protrusion of the disc, we're going to start out at 25%, which is 35 pounds for this initial treatment, just see how you tolerate it. We're going to go for 10 minutes. It's going to be a static traction, which is a continuous. It's not going to relax any. This will be to reduce pain, muscle spasm, and help with that disc protrusion. And then, like I said, we're also simultaneously going to use the hot pack on there as well. It's going to feel semi-warm. We don't want it extremely hot, but enough to get down into the muscle. So we'll have several layers on there, 3 towels folded up, plus the hot pack within its own terry towel. It'll all be on your back and then covered with another towel. And we're going to do that for 15 minutes. So we'll do the traction for 10, have the hot pack on there for 15, so you're going to have 5 minutes without the traction, just to kind of help further relax those muscles. So I'm getting everything hooked up. This is our hot pack. Pretend this is all the towels and all the hot pack itself on there. Everything's hooked up and ready to go. You feeling okay?
Mm-hmm.
Okay, and I'm going to check back here at 3-minute, 5-minute, and 10-minute intervals just to check your skin and see how you're feeling with the traction. All right? Okay, we'll pretend it's been 3 minutes. Go ahead and check you. Feeling okay? Doesn't feel like it's too hot or anything. Just real light pink, which is what we want. So we'll go ahead and go a couple more minutes, then I'll check you again. Okay. How are we doing with the traction?
That's fine.
Is it hurting you any or feel okay?
No, it's fine.
Okay, you're still looking good there. Go ahead and we'll do the 10 minutes, which will be whenever the timer goes off for the traction. And I'll check you a third time. Ding. You're looking good. We'll go ahead and take this off. Or no, we'll leave that on. The traction went off. We'll leave this on for another 5 minutes. Okay, there have been 15 minutes. Take this off here. Give you a good check over. Feels good. Looks good. No blistering. Got the right light erythema, which is good. That could last 30 minutes to an hour after your treatment, so you know, nothing to worry about. If it would happen to turn into anything more like blisters or spottiness, then definitely give us a call. Anything else? Any issues with any of that treatment?
No, I'm sorry.
No? Okay. Well, I'm going to take this pillow out from under you. If you want, you can go ahead and hop up off the table. Stand up, kind of see how you feel. Loose. Still, you still feel probably about the same pain.
Yeah. About the same.
Yeah, it'll take some time for that to decrease. Like I said, this is just your first treatment, so it'll take many, 3-4 treatments probably before you may start to see anything. But we're gonna see it at least twice a week to start and see where we're at. And we'll check next time to see how you're feeling after going a couple days after the traction and all the exercises. Just see how you feel. Do you have any questions for me?
No.
No? All right. Well, thank you, Mason. We'll see you next time.